proceedings. Our first speaker today is Dr. Simon Burry. Simon is a postdoctoral researcher at Olga Tennyson Autism Research Centre and La Trobe University. Simon received his PhD in clinical psychology from Flinders University in 2017 and his Bachelor of Psychological Science from the University of Adelaide in 2013. His PhD was on the development of a new theoretical approach to hope. Simon will give a keynote speech on mental health.
All right, thank you very much, Gemma, for the introduction. Let me get my slides going. Get this around the right way. Okay, can you all hear me? And see the slides as the first step.
Yeah, all good, all good.
Yes.
All good, fantastic, thank you. So my name is Dr. Simon Burry. I'm from the Olga Tennyson Autism Research Centre at La Trobe University in Melbourne, Australia. Today I'm going to talk about supporting the mental health and wellbeing of autistic and other neurodiverse employees in the work environment. I'll be focusing on autism because it's my area of specialty, but the majority of the ideas that I'll be discussing should be applicable to neurodiversity more diversely. And similarly, I'll be speaking about the work environment, but a lot of the key concepts can also be used in like the university sector and supporting the mental health of university students who are autistic and may have a co-occurring mental health condition. So, as I mentioned, I'm from the Olga Tennyson Autism Research Centre, which is the first autism research centre in Australia. If you want to find some more information about La Trobe, you can find it from this link here. Okay, just an overview of what I'm going to talk about today. First, I'm going to talk about mental health and autism more broadly. And then I'm going to try and situate mental health within the jobs, demands and resource model. And this is a model that I think helps get us an understanding of the interaction between the work environment and personal and job factors that can impact on performance and mental health more broadly. And I'll try and introduce the jobs, demands and resources for autism model that we have developed, we being the authors here at the bottom in an upcoming book chapter within Neurodiversity in the workplace. I'll then present a case study of the DXE Dandelion program, discuss current workplace mental health initiatives in the general population, and introduce a new autism-specific workplace mental health resource we've been developing at La Trobe University with the support of industry partners DXE Technology, ANZ Bank, and now with Untapped. So jumping in, people diagnosed with autism spectrum disorder experience high rates of co-occurring mental health challenges. Importantly, within the general population, employment is linked to improved mental health and well-being. And furthermore, mental health conditions in the general population are associated with greater absenteeism and poor work functioning through presenteeism in the workplace. Presenteeism is when people come to work when they're not at their best. However, there is limited research that has examined employment-related mental health benefits or costs in the autism population. One of the early studies coming out of OTARC is a study, longitudinal study, including autistic employees within the DXE Dandelion program. So you don't really need to look at the numbers too much in this slide. What are the key important factors is we measured a lot of mental health factors such as depression, anxiety, and positive well-being just after employees started, and again at 12 months later. And what we found was we didn't see overall improvements in mental health or well-being that we would have expected with employment in these autistic employees. However, it's also worth noting that despite this, qualitative research with the same group has suggested that many facets of people's lives did improve with employment. For example, increase in independence, their financial position, as well as job prospects. However, we did not see overall changes in positive mental well-being or mental health more broadly. And this led us to believe that it's important to come up with strategies and focus more closely on mental health within the workplace. But if we take a step back and look at autism and mental health more broadly, we know that autistic people have significantly higher rates of co-occurring mental health conditions. So in these two studies led by Mirko Uljerovic, now at the University of Melbourne, we see clinical rates of anxiety and depression in around 40% of autistic adults. Around 80% of autistic people have diagnoses of autism and something else, and around 44% have diagnoses of autism, anxiety, and something else. If we step in and take a closer look at depression, we can see that within the autistic population, lifetime prevalence of depression ranges from 28 to 49%, which is much higher than in the general population. Depression in the autistic population is strongly associated with suicide in this population. While autistic people can display depression much the same way that people in the autism population, clinicians supporting autistic people have noted some more common or unique displays of or presentations of depression in the autistic population. And this can be depression displayed through anger or frustration, changes in special interest, so a focus on morbid or death-related interests, changes in self-care, or this is also common in the general population, and more frequent meltdowns. Another area that's emerging at the moment, which would be worth keeping an eye on, but I won't talk about in this current study, this current talk, is the idea of autistic burnout. So it's worth keeping an eye out for that new research coming out in that space. What we do know is that there's people who have a family history of depression or higher IQ or no intellectual disability have a higher reporting of depression. Also, there's a higher correlate of social factors in autistic populations, such as loneliness, reduced social support, and bullying with depression in the autism population. If we look at anxiety now, we can see that lifetime prevalence of anxiety in the autistic population ranges up to 60%. And this can vary depending on the study and the measures used in the study. But what we can see, and in the table below, 12-month prevalence of the types of anxiety disorders as reported by Hullux et al. In a meta-analysis, and compared to data reported in the DSM-5, we can see that across a lot of the types of anxiety disorders, autistic population reports much higher rates of anxiety. What's important to know is, much like depression, anxiety within the autistic population can present atypically. For example, when we talk about social anxiety disorder, in the general population, social avoidance and distress, well, social avoidance and distress are less likely to be associated with fear or social evaluation or judgment in autistic individuals. Another example is autistic people often report atypical specific phobias or anxieties. This could be an anxiety about unexpected sensory input in the environments that they're going into, or unexpected changes to activity or routine. And for some, it's anxiety about not being confident they can engage in calming sensory behaviours in their environment, whether this be through the culture of an environment or the people within it. So what is important to know is that atypical presentation and lack of specific measures that cover the atypical presentation of anxiety in autism may mean that the prevalence of anxiety in autistic people may be underestimated or possibly overestimated. And giving some similarities between how we talk about symptomology in autism and anxiety, there could be some diagnostic overshadowing where anxiety could be confused for autism or vice versa. Another area that I just want to touch on, and is highlighted in research from we've done with industry partners, is the impact of sleep on mental health within autistic populations. So what we know about sleep and mental health more broadly is that sleep and most mental health diagnoses are strongly related, and sleep is often a reported symptom in a diagnosis of mental health disorders such as too much sleep or not enough sleep. If you speak to some sleep psychologists, they'll tell you that in treating any sort of depression or anxiety, it's good first to treat people's sleep and to see if that helps with any improvements in depression or anxiety. But what's important about sleep in understanding its impact on work is that sleep problems in the general population are associated with decreased cognitive abilities and concentration, which can affect work performance and safety. Furthermore, these issues can also distort perceptions of work environment. For example, we see perceived greater pressure and demands at the workplace, which can potentially lead to increased stress. Thus, the effect of sleep on the environment can be reciprocal, whereby stress can lead to sleep problems and sleep problems to greater stress, which then can lead to increased mental health challenges. So there's sleep, or the research into sleep in autistic adults is a relatively new and emerging area of research. But what we do see is that there's much higher cases of sleep disorders in the autistic population compared to the general population. And common sleep problems amongst autistic individuals can include difficulties falling asleep, low sleep quality and efficiency, and circadian sleep wake rhythm disorders. So these circadian sleep wake is when your body clock is not really aligned with the demands of your daily life. So a lot of people's body clock is shifted later, so they have problems getting to sleep at a time conducive to getting enough sleep for work the next day, and thus have greater difficulties waking up to get to work, and then have all the negative effects of lack of sleep during their workday. Amongst autistic individuals, we see that unemployment and social interactions associated with sleep problems. Again, another area of that's emerging research is looking at suicide and suicidal ideation in autistic individuals. And so a lot of this work has been led by Dr. Darren Headley out of OTARC at Trobe University. So in a recent systematic review, it shows that there's increased risk of premature death by suicide in the autism population, a risk higher in individuals without intellectual disability. Ideation may also present in up to 2/3 of people, and up to 35% of some samples have reported a suicide attempt. So this makes it a highly important area of focus in future research, and also an important aspect of why we need to focus on mental health so closely. I'm just going to flip things slightly and talk about positive well-being. So when we talk about mental well-being, we more often just talk about mental well-being as the absence of mental health challenges. And we don't talk more about the positive aspects of well-being. If we look at the definition of mental well-being from the World Health Organization, it says mental well-being is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. And I think this is a very important distinction to make in how we treat mental well-being in the workplace. And this is not only focusing on bringing people up to a base level of mental health challenges, but providing workplace environments and structures and initiatives that can help people reach their potential within the workplace. And this is supported in a way in our recent research. Again, don't really need to look at the figures in this slide. I just put it up for those who are a bit of a stats nerd. But from this 12-month longitudinal study that we conducted with autistic employees, we found a very small but potentially interesting finding was that there was a small buffering effect of positive well-being on depression at follow-up when controlling for baseline depression. So this potentially supports that focusing on mental health or positive mental well-being to improve mental health is a worthwhile avenue of support. So I think it's also important to talk about the environment and its impacts on mental health, and also how mental health can impact people's performance in the workplace. So although pre-existing mental health challenges can spill over into the workplace, psychosocial job stresses within the workplace can affect pre-existing mental health and well-being, and may also precipitate the development of mental health challenges. Indeed, excessive or prolonged exposure to a stressor has long been associated with increased mental health disorders in the general population. However, there is limited knowledge on how organisations can effectively support well-being amongst autistic employees. In the upcoming book chapter I mentioned earlier, we propose that the jobs demand resources theory, which is a conceptual model of job stress that accounts for the complex interaction between features of the workplace and employees' mental health, offers a conceptual framework for better understanding the complex interplay between mental health challenges and the work environment. So the theory posits a range of negative factors that may undermine performance and well-being at work, while also emphasising positive factors that can encourage employees to flourish. The original JDR model was proposed to identify job stresses and explain high levels of burnout across a range of occupations. And we believe that this model, well, we build on this model to propose a new jobs demand resources for autism model that we believe better captures the experience of autistic employees. Okay, now hopefully not scaring people off from the outset, as we have the jobs demands resources for autism model. And first I'll focus on, at the top here, we have demands, so job demands as well as personal demands. And I'll go into these in more detail shortly. What we can see from this model is that job demands can lead to greater negative workplace well-being, such as stress, burnout, state anxiety, and this can have a negative impact on performance, such as greater absenteeism or in-role performance. And it can also lead to negative positive well-being, such as job satisfaction, self-efficacy, and resilience within the workplace. And this in turn can have a negative, can influence performance. On the flip side, at the bottom, we have job resources or personal resources, which can lead to a reduction in negative workplace well-being or an increase in positive workplace well-being. And again, this can lead to performance as well as mental health challenges at the back end. So within the JDR model, job demands are any aspect of a job, be it physical, psychological, social, or organizational, that require sustained effort and impact psychological or physiological outcomes. Job demands negatively influence performance via increased strain, which is reflected in exhaustion, anxiety, and negative health. Thus, demands have a negative impact on mental health and well-being in the workplace. Typical job demands can include physical demands within the workplace, risks and hazards, role ambiguity, so not being sure what your job entails or what you're going to be experiencing throughout the day, time pressures, workload, performance, and emotional demands, as well as workplace bullying, sexual harassment, and job insecurity. So not all demands are overly negative, such as time demands can be a good motivator for performance, especially people like me who need a good deadline to get motivated. However, as we can see, as I suggested previously, acute stress or prolonged stress has been strongly associated with negative outcomes such as poor mental health and physical outcomes. So based on the prior literature on autism and employment, we propose the autism-specific jobs demands in our JDRA. First, autistic employees may experience heightened environmental demands compared to non-autistic employees. Autistic adults who are employed are often working in roles that are a poor fit to their skills, education, and expertise. Poor person job fit and inadequate compensation may also contribute to sporadic work history and high unemployment experienced by many autistic adults. And a research by Dr. Susan Hayward on demands within the workplace we can see differences in social communication and interaction, which are a defining feature of autism diagnosis, may mean that interpersonal job demands related to managing interpersonal relationships, communication, conflict, and team-based work may impose a stronger demand on autistic employees. Moreover, autistic employees may have more difficulty with ambiguous and unstructured tasks or understanding the unwritten social protocols of employment. Excuse me. And in research we've led around social challenges within the workplace, excuse me, we see that we interviewed autistic employees and supervisors from around the world and asked them to detail social challenges in the workplace. And what we found is that when social challenges and conflict do arise in employment, they are more commonly attributed to the autistic employee than the environment or workplace. So we see social challenges were frequently attributed to internal or personal factors with a direct consequence on the autistic employee. Furthermore, resolution was more frequently targeted toward the individual than the workplace and hindered employers' experience of work. So focus on the individual rather than looking at the processes or structure of a workplace that impact more heavily on autistic employees. So therefore, job demands related to social interaction in the workplace come at a greater psychological cost or are more demanding for autistic employees. Jumping back to the model, recent reviews of the JDR theory have suggested that personal demands, which represent individual and non-work factors, may also contribute to the negative mental health effects at work. In our model, personal demands can reflect autism symptomology or the co-occurring mental health conditions we discussed earlier in this chapter. For example, restricted and repetitive behaviours and interests, which are a part of the diagnostic criteria in autism, or difficulties with executive functioning, which can be commonly co-occurring with autism, could present as difficulties planning or managing workloads. Alternatively, many autistic adults experience sensory hypersensitivity, thus the physical work environment, open plan offices, spaces, bright light, people walking behind you, these may impose a significant job demand also. What's important to understand is that job and personal demands are cumulative, which means that seemingly mundane job tasks may become more difficult to manage, thus increase negative impact on workplace well-being. In the general population, job demands have been identified as an upstream determinant of mental health disorders such as depression, anxiety, disturbed sleep, emotional exhaustion, burnout, and suicide. It has also been associated with increased maladaptive behaviours such as increased smoking and alcohol consumption, poor physical health such as coronary heart disease or disrupted immune response, and even death. So, but on the flip side, within the job resources section here at the bottom, we can see job resources refer to any aspect of a job, physical, psychological, social, or organisational, that facilitate individuals' personal growth and development. Resources can positively influence job performance through increased motivation, which is reflected in improved job attitudes such as satisfaction and commitment and engagement, including energy and enthusiasm within the workplace. Examples of job resources in the general population include greater autonomy, goal clarity, a job that people find challenging and rewarding, positive feedback, good quality relationships with supervisors and co-workers, and trust in management. Job resources could also include employer resources such as strategy or policy initiatives, that is such as more inclusive workplace policies or strategies, or as well as workplace mental health services such as employee assistance programs, which I'll discuss in a bit later. Autism-specific job resources may include access to an autism consultant or job coach who provides work and interpersonal support, and workplace accommodations tailored to the individual's specific need, such as ability to wear hearing protection within the workplace. Now, it's also jumping back to Susan's paper, also worth pointing out that early research suggests that autistic employees may not benefit from standard job resources to the same extent as non-autistic people. For example, although social support is associated with greater well-being for autistic people, the preference for and timing of social supports as a resource may differ compared to their non-autistic peers. So in our JDM model, we also suggest that personal resources may play a significant role in supporting workplace well-being. Autism-specific personal resources may include a positive autistic social identity and support from the broader ecosystem, such as family, community, mental health professionals. Moreover, supports from the broader employment ecosystem. This can include capacity building for employers, supervisors, and co-workers, helping build independence in individuals on the autism spectrum from family and support, and help developing autonomy within the workplace. So the jobs and demands resources, the idea is to improve well-being is to reduce demands, reduce demands and increase resources. However, it is also worth to mention that there can be an interplay between demands and resources. For autistic employees, personal demands could also undermine their access to standard workplace resources. For example, difficulties identifying and expressing emotions or difficulties knowing when and how to ask for help can manifest in difficulties not knowing when to engage workplace resources. Conversely, as we discussed previously, atypical mental health symptomology of autistic employees could mean that workplace resources, such as managers or employee assistance programs, are less equipped to know when to provide support to their autistic employees. And I think the job demand reward autism model is specifically important in this current conference because we have, I think, talks coming up and talks that have already happened, which I think speak to this idea of reducing job demands and increasing job resources, such as developing inclusive build environments, which we'll be speaking in the same session, the idea of to help reduce the negative impact of the environment and to reduce these demands and making the built environment more accessible to autistic employees. Or talk later on about creating more neurodiversity inclusive workplaces. This can be an important factor, and this can include within the culture of the workplace or the work environment, or it could also be within the university or the university system, whereby systems and processes are better designed to support and help individuals on the autism spectrum achieve their potential. So there is some suggestion that this is sort of happening in already to a smaller degree. So our JDR model suggests that supporting autistic employees more effectively to manage demands and increase resources could be instrumental in supporting their mental health and well-being, thus contributing to improved employment outcomes. And we see sort of this maybe not talked about in the same terms. So in a systematic review of employment programs or interventions supporting autistic employees, led by Dr. Darren Headley out of OTARC, we can see that a lack of support or understanding in the workplace can lead to difficulties maintaining employment or a lack of workplace accommodation, so a lack of resources within the workplace. I also find that autistic employees within these studies benefit from on-job supports, counselling or job search assistance. Similarly, and again, another study led by Dr. Darren Headley from our work with DXC technology with a qualitative study with the autistic employees discussing transition to work. We can see, again, maybe not talked about in the same terms, but enablers or resources within the workplace can be organisational support for the autistic employees, supportive co-workers, supportive leadership staff, and environmental modifications to make the workplace more accessible. We can also see demands or challenges within the workplace, such as social difficulties or work-related stresses. So although not framed in the terms of demands and resources, some autistic-specific employment support programs have effectively countered some of the negative impacts of autism-specific demands. For example, autism employment programs that reduce emphasis on prior work experience or use job coaches to increase person-job fit can help to reduce the environment and interpersonal job demands within the workplace. A study led by Dr. Rebecca Flower from La Trobe University shows that some programs effectively increase job resources through educating colleagues and supervisors in autism for a better informed support network, or by providing job coaches throughout employment. So I just want to give, first of all, an example of an autism employment program. So this one, an example of an autism employment program that provides substantial support to autistic employees is a DXC technology Dandelion program, which at the time of writing has employed over 120 autistic individuals in the Australian information communication technology sector since 2015. So DXC dispensed with traditional recruitment methods such as face-to-face interviews that disadvantage autistic people. Instead, DXC program utilises an initial information introduction day followed by an extended 2 to 3 week paid training and assessment program. Successful candidates enter a 3-year paid program and work in teams of 10 to 3 individuals. Teams are supported by dedicated and experienced DXC and client ICT staff who train, manage the workload, and provide technical support to the new autistic team members. Team members are also supported by on-site and full-time autism spectrum consultants, specialist support workers who manage related support needs of autistic candidates and colleagues, and provide organisational autism training and other operational roles and advice on suitable workplace adjustment and arrangements. So the DXC Dandelion program has demonstrated a high rate of retention of autistic employees, around 89%, possibly reflecting successful reduction in demands and increase in resources. However, yet again, I'll jump back to our longitudinal study. Again, don't need to know about the numbers, but our longitudinal research has shown that there's limited improvement in positive mental well-being or negative mental health over the first 12 months of employment. So this suggests that there may not be the flow-on effect to these areas for these autistic employees. And indeed, within the program, co-occurring mental health challenges such as anxiety, depression, sleep disorders were recognised as complex factors that needed to be supported to maintain the sustainability of the program. So Michael Fieldhouse from DXC acknowledges that in implementing a neurodiversity program within DXC technology, sustainability involves not only managing autism, but other mental health disorders at the same time. In correspondence with support staff in this program have highlighted that mental health tools and training specific to autistic employees were not available, which prompted DXC to develop specific tools for this population, which I'll get to very shortly. But before I do, I just want to talk first about what sort of workplace mental health and wellbeing supports are in the general population. So in the general population, interventions focus on the primary level, so promoting good health and targeting the cause of illness, such as managing demands within the workplace or stresses. The secondary level is changing how people respond to or perceive illness. So this can be educational programs to better inform staff about mental health within the workplace. Then we also have tertiary levels such as treating, compensation and rehabilitation after illness. So unfortunately, the research is sort of leaning towards more focus in the tertiary level, where we think that more focuses on the primary level, so reducing demands and increasing resources would be the best first step to help manage downstream effects of the workplace on mental health. Interventions can also target the individual or the organisation, or the individual organisational interface, so how people respond within the workplace. But we know from research so far that there is bespoke mental health policies and initiatives within individual organisations. So these can be programs to promote or support mental health within the workplace, such as mental health days or mental health training. And these programs have some success in reducing absenteeism, so people taking time off work or people who have to leave work due to mental health challenges. There are also more broad formal forms of mental health support. I'll talk about two of these examples briefly. So the first one are employee assistance programs. So these are employer-sponsored programs designed to help employees identify and resolve acute personal and behavioural issues that may actually or potentially impact work performance. So many EAPs, employee assistance programs, use short-term counselling to address a specific stressor or situation. The more comprehensive and integrated programs provide broader support, training and resources for both teams and managers, with some EAPs actively involved in health promotion activities. Based on a recent systematic review by Joseph et al., they concluded that EAP users did experience an improvement in overall functioning and a decrease in presenteeism, or arriving at work when not feeling the best. So despite their widespread availability in the workplaces, autistic employees may find limited value in EAPs. So autistic people report difficulties accessing general and allied health professionals who are willing to and able to work with autistic clients. This is just out in the general population. We see this in Australia also, and have reports from support workers we work with in supporting autistic employees that there's a bit of a skill gap within supporting autistic employees within mental health professionals or allied health professionals. So this knowledge and experience gap likely extends to EAP counsellors, whose opportunities for ongoing professional development related to autism is highly limited. Further, given the limited number of sessions provided by most EAPs, which is about 4 to 5 sessions, depending on which country or which healthcare system they're being used in, the inherent communication difficulties in autism, this means that the service may struggle to adequately meet the needs of autistic employees. Another area I want to focus on is mental health first aid. So this was first developed in Australia to address the public understanding of mental health, but it's now been adopted in at least 21 countries with several international evaluative studies. Mental health first aid follows a physical first aid model whereby members of the public are trained to provide initial support to someone developing a mental health issue or experience a mental health crisis until appropriate professional help is available. So standard mental health first aid training and guidelines are regularly reviewed based on current mental health research, and training covers common mental health issues and crisis situations, including depression, anxiety disorders, psychosis, substance use disorders, and suicide behaviours, and many more. So mental health first aid was originally developed as an intervention for the general public, but is increasingly used as a workplace intervention, and has been identified as an effective and evidence-based intervention for reducing the stigma of mental illness in the workplace. However, like EAPs, autistic employees may find access to mental health first aid less beneficial compared to non-autistic employees. Mental health first aid training does not cover autism specifically, and individuals who have received this training may not recognise how common mental health disorders such as depression and anxiety may manifest or look differently in autistic people. Moreover, even when mental health first aid officers and other mental health first aid officers are trained, staff are readily identifiable, engagement with these individuals is likely to depend on the quality of relationship and the trust that other employees have with this person. So in response to this and response to the challenges identified in the DXC Dandelion program, DXC Technology and ANZ Bank funded OTARC, the Trobe University, to develop a mental health and training package that can be used within their workplaces and released more broadly to benefit the autistic employees more broadly across the world. And so what we developed was the Supporting a Neurodiverse Workforce and Mental Health and Wellbeing Resource and Training Package, which is a manual that I'll go into a bit further to support mental health within the workplace of autistic employees. And we are currently working with Untapped to develop this into in-person training, as well as an online training course, which will be available sometime early next year or middle of next year. So within the manual that we've developed, we have 11 different modules. So firstly, we focus on what is well-being and why is it important to focus on well-being. We have a module that helps educate people on what it means to be in the autism spectrum and how best to support autistic employees within the workplace. We're also trying to get at this, the initial level of providing support. We've got a module on creating autism-friendly work environments. So this focus is to reduce demands and make the environment more inclusive of autistic employees. So this includes general information about improving the build environment of a workplace, but also strategies to improving the culture of workplaces to make them more accessible and inclusive of autistic employees and neurodiverse people more broadly. Given the fact that stress can be such a downstream determinant of mental health challenges, we also have a module focusing on stress within the workplace, how to identify it and support it, and what this might look like in autistic employees, and just areas that may be specifically challenging for autistic employees. We then focus on different mental health areas such as anxiety and depression. And within these areas, we first focus on such as anxiety more broadly, what it might look like more broadly. And then we focus in on what it might look like in autistic populations and how best to support them within the workplace. We also focus on sleep, non-suicidal self-injury, suicide and suicidal ideation, and then some general modules on providing and seeking support, and also how best to support people returning to work after taking time off due to mental health challenges. This is an example of what the cover looks like. We have different levels of text, so people engage with the content to a level that suits their needs. And within each module, we also have support strategies targeted at different stakeholders. So we have strategies for the employee on the autism spectrum, mentors and colleagues, as well as supervisors and managers. The manual includes CBT and mindfulness-based approaches to managing health and well-being. And also has, as well as information and exercises that tackle difficult topics such as suicidal behaviour. So overall, we believe it is a comprehensive package that helps support autistic employees' mental health within the workplace, as well as, given the general nature of some of the information, mental health more broadly within the workplace, because a lot of the information specific to autism, we believe could be beneficial to all employees. So in summary, I've talked about today co-occurring mental health challenges and how common they are in autism, present the job demands and resources model as an idea of how best to reduce job demands and increase resources to make workplaces more accessible and supportive to autistic employees. Discuss current strategies to support mental health in the workplace and why they may be insufficient to support autistic employees, as well as introducing our new package called the Supporting a Neurodiverse Workforce, a Mental Health and Wellbeing Resource and Training Package. I'd just like to acknowledge our funders, as well as a big thank you to people who have helped support this research, and also people who were on our advisory panels and expert panels who supported the development of the mental health and training package. Thank you very much for your time and for listening, and also thank you very much to the conference for inviting me. I really appreciate it.